Hi, I'm Rhea from Active Health Clinic, and today I'm going to explain what long COVID is. It is exactly what it sounds. Long COVID is essentially experiencing COVID symptoms and challenges related to the COVID virus following your acute infection. So long COVID, or the fancy term for this, is actually called post-acute sequelae of COVID, so PASC. And this has been around actually since 2001 when we actually saw SARS-CoV-1. Now what we have been experiencing since 2020 is SARS-CoV-2. So long COVID is new and old all at the same time. But essentially to get a diagnosis of long COVID, you'll be experiencing COVID symptoms following your COVID infection. So generally it takes a couple weeks, theoretically, for your COVID symptoms to settle following infection. For those that symptoms are prolonged for 6 weeks or more, depending on your symptom profile, will then indicate that you may be experiencing long COVID. Now, long COVID is as prevalent as up to 6% of individuals experiencing COVID will then be likely to develop long COVID from there. Now, for some, long COVID can last months, and for some, we're seeing long COVID last years. Now, that will be dependent on the person and their predisposing factors to experiencing something like long COVID and their precipitating factors that can exacerbate their long COVID journey. Now, if I were to go into the symptom profile of long COVID, we'd be here for a very long time. The symptoms considered normal in long COVID are actually 100 plus. So it's really hard to say what common symptoms you are likely to see in long COVID. The ones discussed quite commonly are the ongoing cough, the ongoing respiratory challenges. You might experience postural orthostatic tachycardia syndrome or dysautonomia symptoms. You might be experiencing an ongoing challenge with taste or smell, and you might have ongoing fatigue and brain fog, muscle aches and pains, sore throats, virus or cold-like symptoms as well, sleep issues, mental health challenges, all of those kind of factors. So there are maybe symptoms that are considered a little bit more common, like the ones I've just mentioned, but there are ones that could be considered less common, such as skin rashes and hives, or MCAS and allergy or sensitivity based symptom profiles. This can also be ongoing sleep issues and insomnia challenges. This can be things like some people who have experienced hair loss and those kind of factors. So there, as I said, are over 100 different types of symptoms that have been characterized as part of the long COVID journey. And each symptom profile will be different from person to person, again, based on their predisposing factors, but also their comorbidities and what other health challenges they may be experiencing. So if you are experiencing long COVID, it is really important that you have a medical team behind you to help you understand and categorize where your symptoms are, what they fall under, and what sort of medication intervention or potentially pharmaceutical treatment will help you manage those symptoms. So if you do have ongoing COVID-related symptoms following your COVID infection, please speak to your healthcare providers, such as your GP, because they will make sure to rule in or rule out any other challenges related to your health and help you understand how best to manage those symptoms. Now from there, it can be things like pacing and lifestyle management and modifications to help you minimize symptom exacerbation, understanding your triggers and your restorative practices to help with that overall concept of baseline to support your body in working within what it can manage rather than exceeding that and doing what we call booming and busting. So it's very hard to go from us and who we were to then someone who is experiencing health-related challenges and disabilities. So it is really important to understand the impact that your COVID journey is having on you and understand how that may influence your baseline, what it is your body can do, and what strategies help you manage your new baseline and manage your body's capacity. Okay, so please know that you are not alone in your journey. There are hundreds of thousands and millions of people actually around the world that are experiencing long COVID. There is a lot we do know about it. There is a lot we don't know about it at this stage, but there is a lot of research going into this area globally, which means that we will have a lot of answers in the years to come. Now, just because we don't have all of the answers right now doesn't mean that you are going to be lost and forgotten and stuck until we have those answers. There are many things that, as I said, we do know that help us support you in your journey with where you are right now. Okay. So I hope that makes sense. If you have any questions, please do comment below. But the biggest takeaway from this is that it's not normal per se, but it is quite common, and make sure to reach out to your health professionals to ask the questions so that you understand what's going on within your body and how you can best support yourself during that time. Okay, take care.